So what it was is a retrospective study. So we looked at all of the children that were seen in the emergency room at St. Mary's from 2000 to 2007. And we were specifically interested in motocross injuries. So then we looked at the types of injuries that occurred, which patients were admitted, which patients had surgery, and then we tried to put a price tag on it. So we tried to see how much the average cost was. And then that's all the information we had. So then we published that study just on that information. So it was called basically Motocross, the Cost and Morbidity of the Sport. What we found is there were a fair number of injuries. In our study, in 7 years, there was almost 300 patients, and over half of them were admitted to the hospital, and about another third of those required surgical procedures. And the most common surgical procedures that were performed were orthopedic. And of those, it tended to be femur fractures that required intramedullary nail fixation, tibia fractures, sometimes spine fractures, and then there were also quite a few head injuries that got admitted to the hospital. So quote-unquote concussions. You know, we encourage participation in all sports, and motocross is a growing sport in this country. We have 7 tracks in sort of our catchment area. So we're not encouraging not participating, but we'd like the participants to be as safe as possible. So we're looking at what the best protective equipment is and how to try to prevent injuries so you can make it through an entire riding season. And then if you are injured, what we call return to play or return to riding parameters, so you can do it in the safest way possible. So as I stated, there were about 300 patients that we looked at, and about half of those required hospitalization, and another 1/3 of those required a surgical procedure. And out of those surgical procedures, the highest percentage of surgical procedures were orthopedic, so bone and joint procedures, and that was right at about 90% of the surgical procedures. So of course, those are the patients whose bills were more expensive because they required, you know, I'll call it more invasive and longer durations of treatment. So I think from this initial study, our conclusions are a fair number of motocross riders get injured and require treatment. And we don't know what that ultimate number is going to be, because I think we're just kind of seeing the tip of the iceberg here. We don't see all of the injuries. We just see the kids that are injured badly enough to require transfer to a level 1 hospital. And so I think that basically what this study told us is there's enough injuries that we need to do more research. So we're going to be doing a prospective study this coming motocross season to try to gain some more of this information that'll help us guide treatment. And then ultimately our goal is to guide return to riding, you know, protocols, so that when kids do get hurt, they return to the sport at the right time, to try to avoid recurrent injury and to try to have them ride in the safest manner possible and try to prevent injury in the future. And that's only going to come with prospective research. And we're going to start one of those studies this summer at the Millville motocross track. I think the key is basically being able to assess your child and see if they're mature enough to actually ride a dirt bike. It's a motorized vehicle, so make sure they're physically and mentally mature enough to ride, and that they want to ride, that they're not just doing it to please you as a parent. Then to have good and well-fitting equipment, so a helmet that's not too big and a helmet that's not too small. There's also chest protectors, there's tibia protectors, there's special riding boots, there's gloves, there's goggles. We think we're going to recommend mouth guards to try to prevent a lot of dental trauma and maybe prevent worsening head injury or concussion. And then having them practice under your supervision so that you see that they are ready to race and ride. And then have them racing at an appropriate level for their age. So they try to do that based on age. But one of the classes are 4 to 8-year-olds, and there's a huge physical disparity between a 4-year-old and an 8-year-old. And then lastly, having them on an appropriate sized motorcycle. So a motorcycle that's not too big and not too powerful for them, because speed is a factor, and if you ride at higher speeds out of control, you're more likely to sustain injuries. And then after an injury occurs, allowing adequate healing and following the doctor's advice as to when to return to sport, and not trying to return to sport too early, because then you're probably just setting yourself up for another injury, which might keep you out even longer.